My next question is on the child
New
obesity.
research finds childhood obesity rates are getting worse. The study in JAMA Pediatrics found
A side effect of urbanization, both parents working, having less time to cook, and not giving the right kinds of food, 10-minute deliveries, and children not having place to play, exposure to screen time, and parents wanting to indulge the child. So, this has led to an epidemic of obesity.
Do you see that ADHD is also, or autism spectrum is also in increasing in India?
Yeah, over the last 10 years, there has been a substantial increase for autism and ADHD. But we know that it's a environmental plus genetic plus other unknown causes. So, what is important is to pick up these early and to start early intervention.
Stress is more of a very broadly used term. It's a very abused term, I would say. No, I'm very stressed today. Even the children uses it. I was so amazed.
It's not just an exam which can cause stress, or a friend said something, or somebody didn't talk to me and I'm stressed.
Trying to open somebody for a surgery, and you have to make sure that there are people waiting out there, and you need to send them alive. Some of those sorts of professions is actually the real stress.
The milestones which are supposed to come after 9 to 12 months, speech and language milestones, cognitive milestones. Because after COVID, screen exposure in the first 2 years after COVID was immense.
You're exposing a lot of that chemicals to the children these days.
I don't know, right? So there we can try and avoid heavy metals. We can try and avoid some known carcinogens. The JUNCS, what is called the junks. J stands for junk foods, U stands for ultra processed foods, the N is nutritionally deficient, C is calorie deficient, S is the sugary beverages. So JUNCS, these are the ones which have to be avoided.
If not, again, this is a very hypothetical question. If not medicine, what would have been your career?
I love to read and I write poems. I used to learn dance, Bharatnatyam, so maybe I would have pursued something in arts, if not medicine.
You are a popular pediatrician. I think a lot of moving from away from allergy and asthma. Do you see that ADHD is also
Yeah.
or autism spectrum is also in increasing in India too? In your practice, you have seen or
Yeah, very much, very much. Yeah, over the last 10 years, there has been a substantial increase, and that is both due to maybe a true increase in the prevalence, and also due to better and earlier pickups of these conditions because of more awareness amongst parents, amongst doctors, and the therapies are available. So it's both due to that. I think it's the prevalence or incidence may have increased because of so many things. Like again, the uh, diet is one thing, lifestyle, the increased screen time, decreased interaction with peers and with parents. There is a lot of other maybe exposure to some toxins in the environment which we are unaware of. We don't know the exact cause for autism and ADHD, but we know that it's a not one single cause, right? There are some genetic factors which can lead to autism. It's known, but there are most of the times it is not one single genetic cause. It is more of a environmental plus genetic plus other unknown causes. So what is important is to pick up these early and to start early intervention. And it's very difficult because sometimes parents are they have some clue or they are some doubts, they come onto us and ask us, is my child's speech and development on track, or they have noticed some warning signs. But majority of the times it is we who notice these in the clinic and then begin to probe, and then the parents have to go back and think whether child is doing these or not doing these. Then we give them questionnaire which they can observe the child's developmental milestones at home, and then get back to us to see if there are high risk factors, any red flag signs. And then we do refer them to the developmental pediatrician who will do a more thorough assessment and then start on therapies like whatever the child needs, speech therapy or behavioral therapy. So there are these DSM manuals, the diagnostic this, statistical manuals, which are formulated by American Academy of Pediatrics, validated ones, which the developmental pediatricians and psychologists use to actually see which area the child is lagging or has does it fit into autism spectrum, or does it fit into attention deficit hyperactivity disorder or something else, and then accordingly the therapies are started. But
But what
yes, we
was
are
the,
seeing
the
a huge increase.
I think it's right. It could be multiple reasons, especially food also plays a major factor, and the environment around us. So being aware of what you, when you have a young children at home, so what you're using, starting from all the be it a washing detergent or anything which you use which child gets exposure to. If it's toxic, then there is a possible, because today we don't know what are the
Yeah.
toxic ingredients which is aware in any of them in the dresses it's washed, and you're exposing a lot of that chemicals to the children these days. Yeah.
Don't know, right? So there we can try and avoid heavy metals. We can try and avoid some known carcinogens. We can reduce our
Phthalates. Yeah.
dependence on packed foods or which sometimes may contain something that we are not aware of.
Less processed
Carcinogenic,
foods.
yeah, less processed foods, yes, and more it's always better to eat what is seasonal, what is your local produce, some freshly cooked, and avoid the junk foods and the beverages which are of just have empty calories. But many times it is we don't know the cause, and it's just that we have to just pick it up and start early intervention so that to help the child integrate into mainstream as early as possible, to make them independent, to their own course, and to bring them up to their potential.
That's very important because um, the growth period is very important, and they, if they are struggling with these, they lose out on a lot of other opportunities which is actually, or with coping up with the peers in the same group. Yeah.
Yeah, development is a huge, very, very important. And although parents are concerned about weight, height, food, they are not really so aware about the developmental milestones which the child should gain after 12 months. So, 12 to 18 months or 12 to 24 months is a very crucial period. Although the early signs of autism can be picked up even before 12 months, it's usually between this 12 to 24 months that every check or vaccination visit that the parents bring the child for, we follow these milestones very keenly and ask the parents probing questions to see what child is able to do and not able to do. And this earliest red flag signs would be a lack of eye contact. If a child is not making eye contact, if it's inconsistent eye contact, if there is no stranger anxiety, no separation anxiety,
Hmm.
the
Hmm.
child is just oblivious
Friendly. Yeah,
to the
okay.
surroundings,
Hmm.
friendly to strangers,
Hmm.
without any hint of stranger anxiety. More than friendly, they will be indifferent.
Yeah.
So there's no change, behavior change when the child is with familiar people or
Faces.
unfamiliar people, new people. And the milestones which are supposed to come after 9 to 12 months, speech and language milestones, cognitive milestones, these are not achieved at all, or they are very much delayed. Sometimes there's a regression of milestones. Child would have started doing something like waving hi, bye, saying mama, papa, and then there's a regression. After a few months, what the child was doing before, the parents notice that the child has stopped doing that. So that is called regression. That is also a warning sign. So these are all, some things, repetitive behaviors, obsessive behaviors. Sometimes children have these flapping movements, clapping, repeatedly clapping, rotating for no reason, and which you say, something child likes doing something repeatedly, switching, putting a light or switch on and off, or all these things are warning signs. It's not just one. Parents should not panic if they see one, but it's a combination of everything and a proper assessment which is needed if any of these warning signs are there.
Got it.
delayed speech, and lack of communication on social skills. Many times, when we tell a parent that we are suspecting that there may be some red flag signs of autism, they say, no, no, my child is able to recite the alphabet, my child knows all the numbers, all the colors, repeats the rhymes. What are you saying? But it's not about intellectual development. They are as intelligent or even more than the other children of their age. It is about social skills. So that is where we have to explain to parents. There may be something called staccato speech, where the child is repeating something that he has just seen on screen, or speaking like these cartoon characters like Peppa Pig, for example, without any voice modulation, without any emotion, and that is called staccato speech. So again, that we pick that up. And it's hard these days because after COVID, screen exposure in the first 2 years after COVID was immense. Parents had no other choice. They had to work from home, and they had to keep the children engaged, and so it was just screen, which they could fall back on to keep the child safe and also at the same time busy. So we have to first stop screen exposure, tell parents that one of them has to be with the child almost constantly and stimulate the interaction with the child, increase interaction, and then also start therapy sometimes. And many times we see that it does revert in few months to couple of years. But if there's proper autistic spectrum, not just due to increased screen time, then the therapy has to go on for a long time, and it is step by step, and it may vary at different ages. It may vary what the child needs. Sometimes it is speech therapy, sometimes it is behavioral, sometimes it is sensory integration, sometimes it is just with medication for certain causes. Some of these children may have seizures, some of these children may have hyperactivity, so accordingly medication will have to be used. But otherwise it is just therapy. And I have found that the mother is the best person to take charge and to learn the therapies and start doing it at home, because nobody else can do it. Many times it comes at the cost of mother giving up her job, her career. There is loss of income, but those crucial years from 1 to 5 are very important, and many mothers have been able to work so hard on their children, trainers themselves, motivators for other mothers. So it can be very life changing.
True. I think it's I mean, it's unfortunate, but then there are definitely medicines and also therapies which actually can bring back the lost time, and whatever the growth potential with the children has to attain. But I think you've covered the development milestones and probably what parents should expect in the first 5 years, and then the red flags which they have to keep looking at, and go to the doctor. I think the most common childhood illness is, we talked about fevers, allergies, and infections, so which is very common. I think we you also talked about when to pick up the less talked about juvenile arthritis, and the inflammations which can lead to it, more of an autoimmune condition, uh, right? So I think there is broad spectrum of different red flags to look at, but again, not every children fall under that, but it is up to the parents to keep l- looking at the development milestones in the first 5 years, which is crucial, right? I think
Correct.
most of the immunization also happens during that time, and after that, it is more sparse, or so we will be able to, at least the kids will be able to talk about it, and if they have anything in that
That's true.
time.
Yeah, very nicely summed up. That's true. Yes.
Um, I think the next one is, I wanted to talk on the immunization, especially the painful and painless immunization. I think maybe it's a controversial topic, or it's more personal from parent standpoint. But I wanted to, I had this chat with multiple parents when I used to come for immunization as well and outside. This question keeps coming up, right? Having
Yeah.
pain is actually a part of the child's development, so they have to understand the pain as a feeling, when they get hurt or something like that. But what, when did this change? Because I've never heard this unless when I was introduced to that. But I said, no, let me try this painful only, and then see. I don't want the painless, because it's a conscious decision the parent can make. But please explain, what is the need for the painless, and when parents can choose it, or when they can still go with the painful. And it's not like it's fancy and it's new technology, I mean new available medicine, I'll go with it.
Yeah, no, it's not exactly fancy or new. It's just the pain and painless. Basically, see, every vaccine is a foreign antigen which is going to stimulate a reaction. It is meant to stimulate the formation of antibodies in the child's blood stream, so that when the child gets the infection, the body is already prepared. There are already memory cells to fight that infection, right? So the concept of pain or painless is mainly with the DPT vaccine, diphtheria, pertussis, and tetanus, what we call DPT. That is the one which is given at 6 weeks, 10 weeks, and 14 weeks. Then booster doses are given at 18 months and 5 years. So this thing of pain and painless is with DTP, which can be either DTWP, that is whole cell pertussis vaccine, or DTAP, which is acellular pertussis vaccine. The other two components of D and T, diphtheria and tetanus, are the same in both. It is only the pertussis. The pertussis used to have, pertussis is the name medical term for whooping cough, caused by a bacteria called Bordetella pertussis. And whenever the earlier vaccines which were available, at least in India, even now we are still very much using it. The government immunization programs use the wholesale pertussis only, and it causes some pain and fever and local swelling at the site of a vaccination, which can last for about 24 to 48 hours, and that can be controlled with paracetamol. Ice pack can be kept at the site of swelling, and we do tell parents that you can do all this just to mitigate the effects of the vaccination. But in the West, the concept of DTAP had took off many decades ago. So they have been using DTAP, that is acellular pertussis, where the component which causes the pain and fever, which is due to the adjuvant used in the vaccine, has been removed, or it has
Okay.
been changed. Adjuvant means something that is part of the vaccine to improve the immunity or the immunogenicity. It makes the cells react better to the protein antigen or the polysaccharide antigen of the vaccine, and gives better immune response. But over time, the last 20 years, maybe, the studies which have been done, follow-up studies, even with DTAP, it has shown equal immunogenicity, equal efficacy. And there's no, how do we know whether its immunity is good or not? By looking at the breakthrough infections. If 5 years after introducing DTAP, if there was a lot of breakthrough infections of whooping cough in the community, then we know that this vaccine is not as effective as DTWP. But that has not been the case, and so we see that even without the side effects of the pain and fever and local swelling, the vaccine is equally efficacious as the one with the pain. So that is the main difference between pain, and these are given in combination with polio, with the other vaccines, bacterial vaccines like Hib, hepatitis B. So all the combination is available now, even with the government, which is giving it free of cost to every child below 2 years of age, especially the 6 week, 10 week, 14 week. This is a combination, the pentavalent vaccine, which is given. But government is still using the DTWP, our Indian government. Whereas Indian Academy of Pediatrics gives the choice of DTWP or DTAP. We counsel parents what is the difference, and then they can decide. Okay. For all the other vaccines beyond 14 weeks, like we give it at influenza vaccine at 6 months of age, we give measles, mumps, rubella
Measles.
at 9 to 12 months, typhoid, hepatitis A. All these, there is really no difference between pain and painless. So even pneumococcal vaccine. So
Yeah.
there's just one type. So the pain or painless is only based on the adjuvant which is used in the vaccine. Adjuvant means something which is added for better reaction that the
Recovery.
vaccine
Okay.
can produce, not recovery, the immunogenicity of the vaccine, efficacy.
Oh, the
So,
efficacy. Okay.
and that adjuvant can cause side effects of pain, swelling, and local reaction in pertussis in DTWP, whereas that is not seen in DTAP. But doesn't mean that just because there is no pain or fever, this is inferior or less efficacious, or it's something that's unnecessary, and let my baby go through the whole thing. What can happen is, sometimes there is a serious reaction which can happen. Like there can be a high degree of fever, more than 1 or 2, 1 or 3, for about in the first 24 hours of vaccination, or the baby may have excessive crying for more than 2 hours after vaccination, is called excessive crying. So rarely, one in million, there can be side effect of seizures with the DTWP. Very rarely. So if a child has had any of these side effects, then we do not recommend DTWP for the subsequent doses. We advise parents to go for DTAP. If these side effects are not there, then either one can be given, DTWP or DTAP.
Got it. No, that thank you for the explanation. I know that that's more of a concern, or even a question always comes up when we go for immunization. Right? But then why government or the is still giving both of them, right? Then we can decide to just have one DTAP across the board, across all the hospitals, and then
So
practice
in your
that.
country, where yeah, sorry, in the US or in other Western European countries, it is only DTAP which is given. There is no DTWP. In India, the population is huge. Just now, we have been able to achieve, the primary immunization has been made available in the combination vaccine, the pentavalent, across all states. You can imagine the reach that the government has to do to go to the basic remotest parts of the country, the Anganwadi centers, the primary health care centers, where these vaccines have to be given sometimes door to door, and the parents have to be reminded to bring the child for vaccination. So this is just now, I think in the last 5-10 years, we have made inroads, and we are able to achieve a good percentage of immunization. So there is DTAP again will mean almost 1,000 rupees more per dose. So that's a huge amount
Cost
for a
factor as well.
company.
Yeah.
Cost factor is the main thing, and that's why the government is still sticking to the DTWP as of now. We have just, I think, started earlier. It used to be only what is called triple antigen DTWP. Now it is DTWP with polio, with Hib, with hepatitis B as a combination, which is called pentavalent, and that is successfully being rolled out free of cost to all the children at 6 weeks, 10 weeks, 14 weeks. There are still some differences between the Indian Academy of Pediatrics program, what it recommends, and between what the government follows, which is called Universal Immunization Program. So, but I can see more and more, even so-called affordable parents or upper middle class, who prefer to take their child to the government centers for vaccination, and they only bring the child to the pediatrician for a regular check to see if the growth and development is. So that is also fine. We are able to, the government is able to provide free vaccines to such a large chunk of population, so which is very commendable indeed.
Yeah, no,
Been able to eradicate polio only because of that.
mhm.
So those have been major strides.
Even during the COVID, getting the first vaccination, we were sooner from from uh, from the Covaxin and COVID. I
Yeah,
think
Covishield and
Covishield
Covaxin.
and Covaxin. Yeah,
That was excellent development, and for doctors and healthcare workers, it was available within 6 months or 8 months, I think, after the COVID pandemic struck, and that helped to save a lot of lives. So that was major technological advancement.
yeah. I think you've seen that time too, and working in the hospital. So it would have been a life changing experience in terms of
Yeah.
but something not available like 6 months back, and to now you have some people to save with that.
Yeah, we could save lots of lives with the vaccines. The PPE kits made a huge difference. Somehow, luckily the kids were not really badly affected, unlike older adults in the first wave and middle-aged adults in the second wave. Maybe some cross protection from other coronavirus happened during childhood helped the kids to kind of sail through smoothly. Only those who had comorbid heart diseases, immunocompromised children, lung diseases, they were the ones who needed hospitalization. Apart from seeing high fever and some cold cough, we could manage majority of these on teleconsultation and just advise parents what to do. And the kids were recovering quickly, which was good. Of course, some needed hospitalization, but unlike adults, children were not too badly affected. And now COVID is almost endemic. We are seeing a surge again. I think in US you are, and even here. But if we test, we will find it. So it's like the flu virus or other viruses. So we just have to be prepared to deal with it like any other viral.
Yeah, I think there was. I think the flu on the virus pandemic, or not a pandemic. I would say at least the surge of it will come and go in every 5 years with a new type of mutant, and then maybe it's not that effective as it would be as corona, but there is always a rise, and then the medication would. I mean, probably we have to improve the immunization and see how we can handle it. Like bird flu, we had swine flu. So it's a constant with the kind of contaminations and the food habits. It is if really difficult to contain any of this now.
Yeah, true. It's just the vulnerable population has to be protected by revaccination, booster doses, careful surveillance, isolation of those affected, home isolation, unlike pandemic, but and treatment for the those who develop moderate to severe illness. Majority are mild and they can be managed at home. So that's for more for the adult population.
Got it. Thanks, doctor. I think my next question is on the child obesity in your practice. Like, how is it on the rise in India too? Because I see that definitely we have invested. People are oblivion to the fact that that's a concern. So even in adults, so they don't feel that it is actually a concern, and probably they just go with that fact. It's a new normal kind of. But in India, I see that the pattern is not that prevalent from adults, but at least in children, obesity is because of the one is the time they play outside is less, and they are in the apartments and there's no space. One is that constraint, and also they're always in the screen time, and they don't know what they're eating. So both are actually playing a major role in terms of they're gaining weight during their developmental period without not eating the right food, as well as eating more, because the food is available today in excessive, right? We moved from famine stage to now eating a lot.
True. Yeah. Yeah. So it is again lifestyle disease. Again, the side effect of urbanization, both parents working, having less time to cook, and not giving the right kinds of food, lack of awareness, easy options, 10-minute deliveries. So it is all the combination of everything. And children not having place to play, exposure to screen time, and a lot of distractions, and just parents wanting to indulge the child. So this has led to an epidemic of obesity.
Is
Uh,
it true? I mean, do you see what is the percentage you see from your practice from the kids coming in terms of the overweight population? Is it like so high, or is it 50-50?
I would say maybe about 20 to 30% of the
Still high.
kids that we see, it is
Hmm.
quite high.
Hmm.
That's like a ballpark figure. I can't say very accurately, but I'm sure the pediatric endocrinologists will be seeing more because they get referred to them. And we pick it up and we caution the parents that your child is on the overweight side and you will have to follow these practices, and lifestyle changes, modifications will have to be made so that overweight doesn't tip on to obesity. And you should make sure what to do about the diet and how to increase the physical activities that the child has to do. uh, we see a lot in adolescents. They are either sitting and studying for long hours, or they are on the screen. They go through some
The
uh,
teenagers.
yeah, teenagers with their mood swings and everything. Sometimes they just indulge in overeating or eating junk food. So that is again a point when we see thyroid causes, conditions have to be ruled out, or other conditions have to be ruled out for obesity. But majority of the time, that's nothing to do with the hormones. It's just the faulty diet, and parents have to, they cannot the child's diet, no, as a family the change has to be made. So they have to be willing to embrace the changes, follow healthy lifestyle, eat at the right times, moderate portion size, and that concept that our grandparents and everyone used to have, that a chubby child is a healthy child, has now
That's not
changed.
true.
That's not the case. So we tell them that it's okay if your child is skinny, but the height is good. The growth is measured by height. Health is measured by activity and not just by weight. We should not see weight loss. We should not see stagnation, but we should not really see excess weight gain also. Again, that starts right from birth, where breastfeeding is a major help against obesity, and formulas contain more sugar. Unless needed, it should not be used. Mothers should be motivated to breastfeed.
To breastfeed.
Yeah, and then later on also they should have the options of healthy eating, and they should know how to what all to incorporate in the child's diet and what forms a balanced diet. So it's a lifestyle change, and we have to, it's a lifestyle disease, and we do see metabolic syndrome in children as early as 10 to 12, 15 years of age. Metabolic syndrome is a combination of high blood sugar or borderline high blood sugar, high blood pressure, a high lipid profile, abnormal lipid profile, along with being overweight or obesity. And this is like a harbinger of the adult onset lifestyle
Right,
disease.
right, yeah. I
So
think
we
a lot
have,
of times it's even on the girls. The they're not aware of this food habit. It is actually impacting them in terms of getting into a PCOS, or even impacting their conception in future when they become old, right? So I think it
yeah.
starts with the teenager, or even before that, when the whole pattern of eating has set in. So it is.
Very true. Yeah. So girls and boys both, it has to be. Parents are, the good thing is parents are aware now. They are more concerned, and they want to restrict. But it is they find it very hard to restrict when child demands some kind of food, and they feel that if they don't give in to the demand, child will stay hungry, and so that has to be, that has to happen over a period of months to years, and it takes a time, but they are aware. They are willing to meet endocrinologists, they are willing to meet dietitian, and make small changes in their cultural practice. We cannot change rice. South Indians will be rice eaters, North
Yes,
Indians will
true.
be wheat eaters. We can't really change the staple food, and there's no need to do that also. It is about portion control, avoid snacking in between, avoiding the sugary foods, the
A lot of vegetables.
eat lots of fruits and vegetables, seasonal fruits and vegetables, and the JUNCS, what is called the junks. Stands for junk foods, U stands for ultra processed foods, and nutritionally, N is nutritionally deficient, C is calorie deficient, like the
Chips.
chips and the beverages. S
What did
is
I
the
say?
sugary beverages. So JUNCS, these are the ones which have to be avoided, and uh, at least everybody likes to indulge. So I tell the parents that if you cannot stop it, may reduce the frequency. Tell child that if he eats his fruits, vegetables, and homemade food for 6 days a week, he gets one treat. Then slowly reduce that frequency of the treats from once a week to once in 2 weeks. Then the child himself will start liking what is home cooked for him. Again,
Yeah,
adolescents, when they start living on their own after 17, 18, then it becomes a major challenge. They are
I
not
think
able.
that right. It has to be set in from the is as a lifestyle from the from the age of 1 or 2, because then there is no need to be constantly looking at it and telling them. But that
Yeah,
then see, I think a lot of times, this is one more question I have on this topic, is to pick from you. So a lot of times when I've talked to parents, even I have talked to them, how to start having the children like the food and eat. So if you see the pattern, if you see any, I think I can say 90% of the kids today eat with mobile, or the parents cannot feed without showing them a screen or something which is playing, because it is highly impossible these days for the parent to actually ask them to eat food in the growing stage, which is something which I've seen, which I used to wonder, me and my wife, that how is that we have not, it is during the development stage, we have to put effort. So once
Yeah,
the kids know that what they're eating, so then it's become a habit, and you don't really have to tell them eat carrot, eat beetroot, eat apple, because they know that this is good, this is the, this has benefit, and they're eating it, and they know what is apple today. um, Parents say that my child is a picky eater, but they are not picky eater because you've not given them options during the time when they're growing up, or even exposed the kind of food they have to eat in at
yeah,
home.
yeah.
Then we can't blame the children after they grow up, right? So it is,
Yeah, very
how
true.
do you
Yeah.
see that?
Distraction feeding is a big no-no, and it starts right from the time when the child is 7 months, 8 months, when the mother has to resume work. There's a nanny or a grandparent who's looking after the child and who just wants the meal time to be over with quickly, and so it's easy to show screen and just stuff the food when child eats without knowing what he or she is eating. So that is the basis, and it's that's why the self-feeding concepts, or allowing child to pick up finger foods, feel the texture, even as young as 10 months, 1 year, all that helps. And as they grow, then it should be there should be one meal time with all family
All the
members eating
families.
together without any screen, no TV,
Exactly.
and discussing the day, maybe how each one's day went, and concentrating on the food. So I feel our age old joint families were, that was good. The grandparents were there, and they were there to guide the parents, young parents, on how to feed the children. Nowadays it's all nuclear families. I almost don't see any grandparents accompanying the parents. In a way it's good, but in a way they are also not exposed to the wisdom and experience of their parents, and so they have to rely on Google and ChatGPT, and they read more. I've seen mothers with list of questions on the phone, and it's all, half of it is Googled thing, doubts or questions, and they don't even spend that much time with the baby or the young child. And then it's, we have to tell them, just keep all this away, stop googling, and just spend time with your child, teach him or her how to eat, no distractions. We are also at fault, right? We advise our children, and then if we are on the screen,
We are on
they
the
will,
screen,
we
yes.
don't practice what we preach. It's
Yeah.
very difficult to enforce. So
I think
it's
kids see parents as an example to follow. It's not like anywhere else they learn. So when you are eating, if you are telling the kids to eat the vegetables and fruits, if you're not eating it, then of course there's no point. There's no way they will eat.
yeah, or if we are eating it with watching something on
Watching
our
the
phone,
TV, yes.
then that is also setting a wrong message. So all these things have to be reinforced. I'm sure parents, educated parents, are aware, they know, but it is something that we also reinforce from time to time, and these simple changes help. Obesity is also malnutrition. It's not just underweight which is malnutrition. Obesity is
Oh,
also
right. Not eating the
malnutrition.
right nutrition,
Yeah,
right? You're right. Yeah, I think very valid point. I think my aunt has told me when my daughter was born, the first thing I've learned is to, she said 6 months when you eat solid, you just give the food to her, and then she has to figure out and eat it. So she start like even a chapati, just put the pieces there, or even leave it, and she'll just try to
yeah,
tear it apart, and even a
yeah,
rice, just put it, so the amount, so then they know that what is eating, and
yeah,
having them help in the vegetables, peeling it or cutting, or at least small
yeah,
green leaf. So that gives that awareness and sense of responsibility, and say, this is how food is made. This is the vegetable. This is how I have to eat. So then they after,
yeah.
we've never fed them from the time they were like 8 months or so. They both were, they started eating themselves. So, but it is
Yeah,
hard to, you have to spend that time.
I have
It's
to
hard
spend
to
that
do.
time.
It's hard
Yeah,
to
older
do.
children, little older children from 6 to 8 years, you can involve them in the process of shopping for groceries. And nowadays, there's fireless cooking, there's baking, which many children like. So it's a process of getting them interested in food. And local cultural produce is what should be encouraged.
Right. Whatever
So
is close to you, which is grown,
yeah,
and not really like go for
yeah,
kiwi in India when you can actually get amla or something a bit closer to art, right?
which is
Yeah,
rich in vitamin
this
C.
is
Yes.
vitamin C. Yeah, yeah.
So it's both ways. We see a lot of awareness also amongst parents, and where there is a difficulty in enforcing, then we have to take help of child psychologist. We have to take help of nutritionist, dietitian, and encourage talk to the child and encourage the outdoor play and the healthy diet.
I think you when you talked about your practice and especially on pediatrics as well as rheumatology, I think you mentioned that there is a Siddha person also, or there is another combination of practice which you have recently added in your clinic, is what
No,
I.
no. No, 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 not in my, not a combination practice. I said I have a physician assistant who is actually a graduate from the
Oh, Ayurvedic, yes, yeah, that's
Ayurvedic
Siddha,
field of
correct.
medicine, but
Ayurvedic field of medicine,
who has been working with me now for a year, and so it has been easy to train her in modern medicine. We don't
right?
prefer
It's
to
a
use allopathy term. It's not a pathy, but in modern medicine, which is evidence based and which is for which everything is transparent, and you can anybody can read up on the ingredients of the medicines
right,
that we
right,
prescribe
right.
or look up for the basis for which we prescribe the drugs. Whereas that is lacking in homeopathy or Ayurveda. I don't know about those streams. I am not the person to comment or say that this is better or that is not better. But these are the pitfalls of the other streams. Many children, especially with allergies, asthma, they do well. But nobody with something like rheumatoid arthritis or so has ever benefited or gone into a full remission with these other therapies. It may help for a short period of time, but they come back inevitably with severe symptoms and sometimes irreversible organ damage, which we cannot do anything about. So that is something we have to avoid, and it's a ongoing process. We can't help it. Parents, chronic diseases, it's very difficult to convince parents that they have to stick to the treatment. So they will look for other shortcuts, especially the ones who are not affordable, who are in remote areas. They go to these other pathies, and then when they come back, it's difficult for us to get the disease under control.
Because it's
So,
already progressed
yeah,
a
it's
lot.
already progressed. Yeah. So it's all about counseling, ongoing communication, following up with the child, and parents also being willing to, continue the treatment.
So is it the awareness? I think the Googling and then the parents asking a lot of self. Probably they come with questions which is more standard. Right? You see that the pattern is same even in the government hospitals where you actually do the honorary. When
Yeah.
you look at the patients, the parents. Do you see similarities between the parents there and or in the urban or in the clinic in the cities, or it is still
See,
the
similarity is when the concern and care for the child and wanting to get the child to get better quickly. The differences are they are in the government hospital, they come from all backgrounds. Majority are from the rural areas, and they are not. There's a problem of affordability. There's a problem of education, and sometimes real lack of awareness about how to give medications. Many times we use steroids and we tell them how they have to taper. But when they come back after a month, despite having explained to them, we see they have not tapered and they are following the higher dose. So, or they have stopped it on their own. Or we have told them the side effects of steroids, but somebody tells them, "Oh, your child is looking chubby. This medicine is harmful. Don't give it," and then they stop it. So these are and when they come back, we have to start all over again. So that lack of compliance with treatment is something that we see in rural areas because of either lack of finances or not willing. Many times the father is not there at home or is an alcoholic, or there's no one to bring the child and the mother. They don't even have money for transport to come to the clinic. Although we are seeing improvement in the levels of awareness, and also I feel that overall poverty levels have reduced. Majority are able to afford the drugs. Government is providing many drugs free of cost, including biologics and in some rare diseases. But the the in urban areas it's the other way around. It's an option of plenty. They feel, oh, this doctor has, they go doctor shopping to look at other options. and they Google or read up, and then they try to question the doctor. It's very good to have educated and aware parents, no doubt, but the lack of faith is something that we sometimes find it difficult, and unfortunately the child's treatment suffers. So it's all about how we can counsel, and also the parents this thing uh, willingness, and how we retain the patients. And also that's why education awareness programs are important. We recently did one rheumatology awareness program by involving our pediatric rheumatology patients. April is observed as Rheumatology Awareness Month by Indian Rheumatology Association, and that was something, where parents whose children are already on treatment also had doubts, said, how do we pick this up early? I was told that I have to operate my child's hand because she had a wrist joint swelling, and then I'm lucky that I came to the rheumatologist and no operation was done. Many times we see these children coming with big scars of operation, of surgeries which were
After
not,
surgeries, they come to
yeah,
rheumatology.
which were not really indicated. Which was, see, still many times they go to the orthopedician when child has joint pain, joint swelling, or in rural areas they are referred to maybe some other doctors who are not trained in these awareness of these in diagnosis of these rheumatological conditions. That leads to delayed diagnosis. But now it's a very rapidly upcoming specialty. Hopefully, we are trying to penetrate into every possible city and get the awareness to improve.
Thanks, doctor. I think I've covered all my questions. The last segment I have is something rapid fire. So I wanted to quickly fire those questions to get your answers. So the first one is pediatrics. If you have to put one word, what would be that? What comes to your mind?
Uh, a
Maybe,
satisfying career, job satisfaction.
okay. That I know your first love is pediatrics, so I expected. I thought you'd say first love
Okay.
or something of that.
Yeah.
Morning rounds or evening clinic? What's your favorite?
Morning rounds. I'm a morning person.
One myth about pediatric rheumatology you wish everyone knew this truth about.
It's a lack of awareness which leads to them not these conditions not being picked up early, and it's not that there is no treatment option is available, and it's possible to put the child into disease free remission.
A lot of times lack of awareness that this is the constant pain could be something towards arthritis, or you can at least get a consultations, right? It's important. That's true, right? What's the most underrated symptom parents should never ignore, or
You mean
probably say,
generally, like uh,
yeah.
in pediatrics as such? Yeah, I would say development, the delayed development is, I feel that it gets missed a lot, and we see that early intervention has not been started. So delayed speech, even till today, it is considered that boys may speak late. It's okay to wait till 3 years. So these misconceptions have to be corrected. And
You're right.
yeah, in pediatric rheumatology specifically, it's like joint pain or joint swelling is not always a it's not always a orthopedic issue. So there may be other factors.
Biggest challenge in treating your patients with autoimmune conditions. So what would be the biggest
Yeah,
challenge?
in just I think these are chronic illnesses, so we have to ensure compliance. We have to maintain fine balance between immunosuppression and risk of infections, and just the availability of drugs, also the affordability. So biologics are excellent drugs, but not all our patients can afford them. So, and trying to reduce the steroids as quickly as possible to minimize the side effects.
If not, again, this is a very hypothetical question. If not medicine, what would have been your career? If you can
I
think
think,
of something close, or
I don't know, maybe a teacher. My other hobbies are I like to interact with the youngsters, to teach, mentoring, and I love to read and I write poems. And I used to learn dance, Bharatnatyam. So maybe I would have pursued something in arts, if not medicine.
Okay. No, I think that's a lot of interesting phases of you, which I'm hearing. I think Bharatanatyam, arts. I mean, writing a poem, which is maybe you should just put some quotes sometime in some of your LinkedIn or in other places, some of your poems, so for us to read.
I
But it,
should, yeah. During the COVID pandemic time, there was a lot of free time, and I should, dig out those which I
yes,
wrote at
yes,
that time. Yeah.
maybe compile into a book. So anything in the future we can look at from Dr. Jyoti from rheumatology as a book from your practice.
Uh, and rheumatology, I have contributed to chapters in textbooks, but for the general public, I'm just in the process of kind of completing a common health problems in children book that is more general pediatrics rather than rheumatology.
Data and
And
rheumatology.
yeah, rheumatology wise, it's just I'm more into the Pediatric Rheumatology Society of India, improving
On the
the
teaching, you're already doing the teaching as
yeah,
well for that.
yeah,
Yes.
right.
I think you have a
So
passion to progress in the medicine as well in terms of your teaching, I guess.
I feel it's important to stay updated. Otherwise, it's very easy to stagnate, and that's not at all. We can't afford to be redundant. There's a need to stay relevant, so we have to keep updating. And the best way to do that is to teach. So that's when we read.
Yes. No, I think that's true. Knowledge is wisdom, and you have to keep sharing. That's I think
We
a lot
learn
of.
from our juniors as much as we learn from our peers, our patients, and our teachers. So.
Thank you, doctor. One thing that always makes young patients smile. So what is that from what you have seen? The young children or young patients. So one thing which that makes them smile when they come to you.
Uh, a familiarity is one thing, and we being approachable and just taking few minutes in the consultation to make them comfortable and allowing them to handle certain things like toys or our stethoscope, and they are of course I don't distribute candies or anything, but that does make them
That's
smile.
good. I know. Yeah, that thing we don't encourage to have them sugary substances.
Yeah,
Yes.
yeah.
Most rewarding moment in your pediatric career so far. Most rewarding moment, if you have to think of. I know I'm digging up a lot of questions. Nostalgia, I guess.
Just trying to think. Mm, well, when professors, senior professors, and teachers appreciate the work done, and when you look back at how far you've come, that is rewarding. When we are able to get a child's rare disease or chronic disease into remission, and we see the child progressing in terms of school and growth, that is rewarding. And when we see patient who remembers us after many years and comes back to thank us or to meet or just to update, that is again very rewarding. So
A lot of
yeah,
moments. You can't put
lots of,
one
yeah,
to it.
can't put one this thing to it, but
Yes.
I think recently this rheumatology awareness program that I did, Patient Connect program rather, was very rewarding because I was happy to hear the the appreciation or the um, uh, goodwill of to have gained the goodwill of so many parents, although they knew that it's an ongoing thing, they have to continue treatment, they have to monitor the child for many years. Still, the faith of these parents was very very gratifying, rewarding, and that motivates us to do more.
Yeah, I know. There are a lot of respect for. I think this is one thing which I wanted to also, while deviating from the rapid fire questions. I know a lot of times this stress is more of a very, very broadly used term. It's a very abused term, I would say. No, I'm very stressed today. Even the children uses it. I was so amazed. Even today here, if in US, a lot of times I've seen that, hey, I'm stressed, and a lot of people say I smoke because I have stress. I think I keep telling, even when I'm doing some one-on-one with my team during in the office also, right? You know what is stress? If you're really in a if you're a doctor, you're actually in the healthcare professional, you're trying to open somebody for a surgery, and you have to make sure that there are people waiting out there, and you need to send them alive,
Yeah,
and they have to recover. So, or you have to be in the border, fighting for
yeah,
your country, right?
yeah.
So some of those sorts of professions is actually the real stress. You can't just
Very
use
true.
stress as a word, which is very abused these days for whatever wrong reasons, right? So I
Very
know.
Yeah, I mean, not just US, even here, youngsters. So they have to learn to cope. Those are coping skills which they have to learn, and it's not just an exam which can cause stress, or a friend said something, or somebody didn't talk to me and I'm stressed. So we see a lot of that happening here as well, and it is counseling, and it is they have to learn to take this as part of, because at every point in life there will be something or the other which
It may not
causes
go as
stress.
you expected. Yeah, that is not stress. Yeah.
Yeah,
Yeah, I think that's what. And when you said rewarding, I can see that the when a somebody like autoimmune condition, or even an arthritis in a juvenile, let's say if it's a 1 year old, 2 year old, or 3 year old, the peak time of their formative growth period is stopped, and getting them back, and there is a remission, and then you see them coming back, and they're going to school, and that's I think
yeah,
the amount of stress you go through on the parents, and then trying to make sure the
yeah.
kids. So
Correct.
I mean, I know it,
3 years ago, this child came in a wheelchair, and just this last month, he did perfect yogasanas, the most difficult asanas in that Patient Connect program. So I felt so happy seeing that. So there was another child who had a very bad infection, who recovered from it, and who could sing. She had a very bad lung infection. So this, and she could get back to her singing. That was again amazing. So that way, there have been many rewarding moments. For me, it's not about monetary monetary gains. It's those are important. That happens. I've always believed that that
that's
will
an
happen on
outcome. Yeah,
its, that's and that happens on its own. We do good work, we do ethical work, and we are um, available for our patients, and we do the best that we can for them. The child is the center of our treatment, and then everything falls into place.
I have two more. I think I know. I had a question on favorite pastime, so now I know the answer already. That you're maybe you're reading books and dancing. Also, I hope you do that when
No,
you
no,
socialize
no,
or in a
not
function. No,
MBBS took away that
calm.
portion. But yeah, with very close friends, or with some, at some gatherings or so, just unwind, yes, but not the classical dance. I've not been able to get back to that. But
Yeah, that's
yeah, it's more of
free. That's
yeah,
the free form. Yes, of course, you can always shake some legs in any of the events, right? Yes,
I'd
and
rather read a book than watch a series, but now slowly that the OTTs are so
addictive.
enticing that sometimes we get hooked onto those. Yeah,
Yeah, I also try to. I mean, still there are a lot of audiobooks and Audible and all that, but somehow I feel that the touch and feel reading books is,
yeah,
which brings. I think that improves your memory too. You are able to remember
yeah,
more when you read and write. As you as
yeah,
a pediatrician, you would also suggest that to the kids to write.
yeah.
What are the parents' question you hear the most?
Yeah, it's just about growth and diet, and about what should we avoid when child is unwell. So that that is something that we have to keep on reinforcing. Maintain good hydration, give lots of liquids, give anything that
Yes.
child wants to eat or is willing to eat. You don't need to avoid. And I think I did mention yoga. Yoga is my go-to thing for relaxation, and it's become a part of my lifestyle now. And I hope to continue being consistent with that.
Yeah, I
So
think I see that in your I mean, you're glowing with the knowledge and 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 after all this stressful work, also you're able to be happy and try to. I mean, it's not that the clinic practice stops and after that you come back and you're a mother and you have a son, right? So he's in
Yoga
college.
brings that sense of balance. Yeah, he is in grade 12 now, so yes, stressful again. But I wish he
Yes.
would take up a bit of the yoga practices that I
Yes.
do just to keep himself balanced. But he
So,
has his own.
so is he in the
Stuff.
path of becoming a future doctor? Is that
Yeah, he too has chosen for this path, and
nice?
my husband is a surgeon, neurosurgeon. I am a pediatrician, and somehow in grade 9 he flipped from not at all doing medicine to being oriented towards medicine, being more sure in grade
Nice.
10, and in grade 11 he has even dropped maths and has made up his mind. So he is taking the coaching and to prepare for the competitive exams for medicine.
Okay, someone to carry your legacy too. Yes.
I
Uh,
hope so. It's still a long way, and he
yeah.
still has to get in. So,
One word your colleagues would describe you. That's the last question, right?
oh, okay. Empathetic, I guess. I would think that maybe patients,
Yes.
empathetic, and
Yes.
colleagues also maybe popular pediatrician that I've heard sometimes from colleagues.
Yes, you are. You are a popular pediatrician. I think a lot of times I know my doctor. First time I know my Vishnu Priya was my our doctor. When I said okay, I met Dr. Jyothi, she said okay, you are in very good hands. So that's what she said. So
Thank you for the kind words. I don't know if I'm that deserving. There are many more who are very well qualified and very much, I look to learn from everyone the best qualities. But thank you. And it has been a pleasure. Yeah.
yes, thank you, doctor. I think I have I think it's privilege to have you in my show and talk about your favorite practice, rheumatology and pediatrics, your first love. So I hope
Yeah.
to have many more ones conversations in future. But it was so heartwarming, and I've learned a lot through this conversation, more on rheumatology and other parent concern questions as well. So thank you for doing
Thank
this.
you. And may I say something last word? I
Yes.
never knew that you were having this podcast or a caffelogue. And what I remember from my interactions with you when you would come as a parent was that you were a very shy and reticent the parent, and who was very very reserved or diffident about asking questions, and you would follow up and follow everything that I told you. But this side of yours is a very very welcome and positive revelation, and I'm glad to see you doing such amazing work. And it was very nice to touch and meet, to speak to you after all these years.
Yes,
So yeah.
yes, doctor. Thank you so much. Thanks for that. I happy to hear it from you and it was wonderful talking. I think it didn't feel like time flew so fast and thank you so much and have a wonderful evening.
Thank you. You too.
Yeah,
Yeah. Have a good Sunday, and thank you so much.
yeah.
Yeah.
Bye, doctor.
Bye.
Hello, everyone. If you like this conversation, please don't forget to hit the like and subscribe button for latest updates in my show, Caffelogue with Naga. Thank you so much.